respected director and other dignitaries, as well as the speakers of this session as well as other sessions. First of all, apologies for starting this program a bit late. I'll try to cover by doing this presentation much faster. So, as he has explained to you, you can see this medical imaging from fundamentals to future, whole day of medical imaging from the length and breadth of it. So, I will try to introduce it with a short introduction. So, the question is why imaging? So, we need to know the structure, the function, the mechanism of disease and causation, and medical imaging can guide therapy. This is for whatever we cannot see from outside the body. So, what is the ideal imaging modality? An ideal imaging modality will be able to show the structure of the tissue or organ. It will show it can indicate or help us to understand the function of the tissue or organ, and we should have the ability to identify the mechanism and cause of dysfunction or disease, ability to assist in therapy with no side effect on the body and non-invasive. From time immemorial, we have been looking at the body with our eyes, and to assist the eyes, we have developed many instruments, starting from the magnifying glass to different types of lenses and other things. We can look at the body fluids that come out of the body, like with a microscope, using urine, urine, stool, or semen and other body fluids. Looking inside the body through transparent structures like the cornea, using an ophthalmoscope, a lot of information can be gleaned. Looking inside the body through the natural orifices, endoscopy, laryngoscopy, hysteroscopy, cystoscopy, etc. Means so many scopes are there. Dr. Biju will be dealing more with those scopes. Looking inside the body through keyhole surgery, that is laparoscopy, thoracoscopy, arthroscopy, fetoscopy, etc. That means you make a keyhole and you go inside and you look at it using your eye, but assisted by lenses and instruments. Then, of course, the old school, looking inside the body by cutting open the body. Laparotomy, craniotomy, thoracotomy, when you can't find out any other way. Exploratory laparotomy, as you all know, that when you can't find out the reason, you need to go inside and see. Usually, most of the times it is for, not only for finding out, but we go inside and treat. Why I am putting that as part of imaging is, it is most of the time, the surgeons nowadays are using microscopes and other imaging devices to help them to see what they are seeing better. Then finally, looking at the tissue taken out of the body, the tissue that is dead, processed, and we look at the blood tissues using light microscopy, and we have an entire session in the afternoon to take you through the different styles of going in, seeing as close to the cell as possible. So the next few minutes, let us look at an overview of the whole thing. Among all these things, we have different talks which will go into the other types of lights. But among this, one thing which won't be discussed will be the fundus. This is the only part of the body where we can see the blood vessels from outside the body without going inside in a non-invasive way. And it has held a lot of potential. Initially, or even now, it is actually looked at by the ophthalmologist, but a good clinician should always carry an ophthalmoscope, and it gives a lot of clues to the diseases. The recent interest in the fundus images and the retinal images is that Google, in association with Shankara Nethralaya in India, as well as a few centers in the US, is using retinal images and artificial intelligence to predict many diseases, including the risk of heart attack. Diabetic retinopathy, of course, is a complex thing, but that also is being automatically detected using retinal images taken remotely and processed using Google systems. Imaging using the signals coming out of the body. There are so many things that are there in our body from which the signals come out. That is also one type of imaging. Electrical signals from the heart, brain and muscles as ECG, EMG, EEGs. Magnetic signals are also there from the heart and brain which are being studied. Thermal imaging can be used for breast and lower limbs. The thermal imaging used for as an adjunct for many types of cancer detection. It's not a standalone imaging, but ECG is one of the things that all of us know, that one of the widest and the most commonly used imaging. Only thing is that when the strict sense of imaging, it's a graph, but the next image you'll understand that it's much more complex than that, much more things are there behind ECG. These are two images. The first one is an intracardiac electrocardiogram and a CARTO map that is used for a procedure called electrophysiological study and radiofrequency ablation, in which the electrical signals to the heart from different points of the atria is depicted as a map, the distance and voltage map. And this will help a electrophysiologist to find out the mechanism of arrhythmia very accurately and cure the patient. And the second one is a image from a real patient that we are doing a research with the Indira Gandhi Center for Atomic Research, in which the magnetic signals of the heart are picked up in a non-contact way and displayed. And this is a non-invasive way of detecting a lot of conditions of the heart. We are exploring that. Imaging using sound waves. Dr. Arun is going to give a lecture after this. The surface ultrasonography all of us know. Then there is vascular ultrasound, which studies the vessels. Then you have invasive ultrasonography. Ultrasound, you can put it on the tip of an endoscope and go inside. Then you call it endoscopic ultrasound. Echocardiography, when a cardiologist does it, then we put it through the esophagus to study the heart without any restrictions of the bony cage of the thorax. You can see it from the esophagus through the atria. Then you have intracardiac echocardiography, which gets higher resolution, and final frontiers of intravascular ultrasonography, in which the vessel is cut into small pieces and you can see it live, the structure of the vessel. Now looking at the electromagnetic spectrum, we looked at the light, we looked at the sound. Now electromagnetic spectrum, you can see that the wavelength is maximum for radio waves and minimum for gamma rays. As the wavelength decreases, the energy increases, and the last two, that is X-rays and gamma rays, have got ionizing properties. Most of this electromagnetic spectrum is currently being used in one way or the other for imaging or therapy in medicine. To summarize the whole, you use gamma rays for SPECT imaging. We have a session around 11 o'clock. X-rays are used for X-rays as well as CT scanning. Then ultraviolet rays and other things are used for fluorescence imaging in microscope, as well as it is also used for therapy in many medical conditions. Near infrared and infrared imaging is happening for not only for thermography but also for a lot of other things like optical coherence tomography. And then there are microwaves and radio waves. Radio waves are nothing but what we are getting the output in MRI. X-rays for imaging are actually depicted in two ways. One is what is called as a projection imaging, in which the X-rays pass through the body and all the structures together create a composite image. The problem here is you do not know what is one after something that is standing behind, somebody is standing behind, or one structure that is standing behind the other structure is not depicted in this. It's just a shadow. But this has been the oldest one, and this is even the most commonly used for most of the orthopedic conditions. Tomographic imaging is when the image is, you get slices of the body. That is what you have the computerized tomography scan. And fluoroscopy and angiography is commonly used in many departments, especially in cardiology, and orthopedics and endoscopy, urology and such departments are used. Most of the times fluoroscopy and angiography is used as part of therapeutic procedures. Here you can see an atrial septal defect closure in the first one. In the second one you can see a balloon metal valvotomy, and the third one is coronary angiography and angioplasty. Optical coherence tomography is a very exciting part in which, just like ultrasound, the light is used, near infrared light is used, laser light is used to penetrate the tissue, and based on the reflections, this type of images are formed. The importance of this image is what you are seeing here in the first one, and the second one is that it is the coronary arteries which appear as if they have been sliced in a histological section, and the last one is the retina. So all these things, the advantage of this particular modality is we are almost getting like a microscopic images. The resolution is almost like a light microscopic resolution. Coming to the critical components of imaging systems, optical systems are very important for light-based imaging, how the optics are set up and designed. Electromagnetic source generator is very important, whereas for all X-ray generators as well as the magnetic generators for the MRI and other units, and the agents that are used for gamma cameras, the detectors and collimators that collect the signals, whether it is radio frequency signals or whether it is light signals or ultrasound signals or X-rays. Image processing hardware and software is extremely important. The contrast is a very important point, and the spatial resolution and interaction of the imaging medium with the normal and abnormal tissues. So deep understanding of each of this is required for optimal understanding and analysis of most of these imaging systems. Coming to the radiation risk of imaging, there are a set of visible light, ultrasound, MRI, optical tomography, thermography, ECG, MCG, all of them do not have risk, but the risk is there for all the other ionizing radiations. And this pyramid that I am showing here is in millisieverts, whereas bone densitometry has got only 0.001 millisievert, and it goes up all the way up to 40 millisieverts for SPECT cardiac stress test. So as the different types of imaging using X-ray, you have higher and higher doses of radiation. We need to be worried about that. So with that brief introduction, I request Dr. Biju to continue with the second part of this. Thank you.